My name is Ekta Grewal and I'm the founder of Sikhs in Clinical Research. Sikhs in Clinical Research is a growing initiative to raise awareness of clinical research in the Sikh community. This role is extremely important to me, and I take this role as a great responsibility and passion. When I attend conferences, I'm usually the only Sikh person in the room, and I want that to change. Representation has a ripple effect. When one person enters the field, it empowers the next and the next. And I strongly believe representation is not optional. It is needed. It is fundamental. It is needed for scientific rigor, safety, validity, and better health outcomes. Let's take an example. An epilepsy drug, carbamazepine, caused severe rashes in some Asian communities. If these communities had been represented in early research, this could have been prevented. If communities are not part of research, medications may not be safe and effective for them. Life is never planned, and sometimes we only understand the issues when they impact us personally. Over the years, I experienced the loss of elderly family members who faced medical conditions we are not having discussions about. It's not very common to talk about health issues openly. And because of that silence, health disparities are rising. What if people are missing their doctor's appointments? What if people do not have health insurance or transportation? What if there are cultural barriers and language barriers? What if people are not getting the health screenings done simply because of the reason that there is a lack of education, and they are being diagnosed at a later stage when conditions are non-treatable? It's a huge disconnection. And where do patients end up in this? And how can we make a difference and create value? I'm very passionate about clinical research and health equity. I believe everyone deserves equal access to healthcare, clinical research, and available opportunities. As we all know, healthcare is transforming, and trust is the biggest factor. I often ask my community members, how many of you have participated in a clinical trial or know someone who has? Most have not. And the truth is, most people are never even informed of or educated on clinical trials. Every individual action matters. As an immigrant, as a woman, as a Sikh woman, minority within minority, I felt a responsibility to create a change. And this is how there was an uplifting moment in 2021 when Sikhs in Clinical Research began. There are more than 500,000 Sikhs in the US. However, due to lack of awareness, our community representation is low in clinical research. The Sikh community has always been ahead in humanitarian service, to blood donation drives, when it comes to helping others, charity, contributing globally as Sikh values we carry. Even during pandemic, Sikhs were ahead giving free meals and Sikh medical professionals treating affected people. When disasters strike, Sikhs show up with hands ready to serve. One of the most beautiful traditions is free meal to anyone who is in need. How can we be behind in research when we become aware that contribution to research not only help us but many in the future? Increasing representation will lead to more equitable health outcomes and ensure that treatments work for everyone. Clinical trials should not be seen as a last resort. People should know of their options early. This is where we come in as Sikhs in Clinical Research. According to the American Cancer Society, there is a 1 in 8 chance that a woman will develop breast cancer in her lifetime. When we look at the statistics from American Diabetes Association, diabetes is among the top 10 leading causes of death in the United States, with 1.4 million cases diagnosed each year. In this moment, we know there are people running out of options. In this moment, we know there are people who do not have access to clinical trials. In this moment, we know there are parents desperately looking for treatment options for their children, and children searching for hope for their parents. Health is one of the most important rights that we are born with, and we need to take hold of this right. We have to be our own advocates. I love seeing these conversations happen. Let's continue. Community engagement is at the core of everything that we do. We meet people where they are. We set up educational booths. We start with disease awareness, improve health and research literacy, promote health screenings, educate the community in their own language. We distribute a lot of educational materials, help people understand clinical trials, help them understand the process, and help them understand there are safeguards in place. So far, we have organized more than 50 on-the-ground camps across different states in the US. We have reached more than 7,000 community members, and we have distributed thousands of materials with an aim to reach more and more people in the future and help them understand about clinical trials so they know of their options. Our efforts are still going on, and we also encourage community to talk to their doctors and ask about clinical trials options. We continue receiving testimonials from the families who say these conversations add to their knowledge and understanding of clinical research. And this is something that is keeping us motivated to do more and more. We also started patient-focused perspective series, and I had the opportunity to talk to a couple of breast cancer survivors, and their words have stayed with me. One of them said, "You have to be your own advocate. It's your body." And I could not agree more. And one of the most powerful message that we often hear is, "I would have participated in a clinical trial if somebody had given me the opportunity, or if somebody had given me the option." This is where we see how important it is to be a voice within the community and bridge the gap. And this is where we come in as Sikhs in clinical research. We cannot sit back and allow our family members not to have access to the information simply because we are not talking about it. We need to be better informed. We need to know what the diseases are, how they are impacting us, and what treatment opportunities are available so we can make better health choices for ourselves. At the same time, we also expect healthcare professionals are trained so they can give patients culturally competent care. With over 10 years of experience working with patients at various research sites, including community hospitals, my patient stories are very close to my heart. They inspire me every single day when it comes to the improved life expectancy and the survival rate by participating in a clinical trial. At the same time, I have also seen firsthand how little awareness there is in my own community regarding clinical trials. Here are some barriers to the participation. The biggest one, lack of awareness. People do not know what clinical research is. Then there is language barrier, especially among elderly. Then there are cultural barriers and demographic barriers. To address some of these, we have created educational videos, we have created educational guides, brochures, We educate community in their own language, and we also created Sikh Patient Care Guide to help healthcare professionals learn about Sikh faith so they can give Sikh patients the culturally competent care. Even in my own work at community hospitals, where we serve diverse minority patient populations, I reflect on how important it is to expand access to translation services, to address logistical barriers in low resource settings, and to understand how patient education, cultural differences, health beliefs, and perception of clinical research influence clinical trials participation. We are creating new ways for the patients to gain information, awareness, and the opportunity to make the best choices in their health journey. We have to do a better job in making sure that we are informed and that we are asking, how can I be part of a clinical trial? It takes a lot to build trust. We are trusted voice within the community. We want to make sure that the information is available to every patient. We are all in this together. I'm very passionate about this work. Behind every patient, I see someone's father, mother, child, or sibling. Sustaining progress requires collective action. There are many ways people could join in. If you are good with social media and networking, there is a brand ambassador opportunity. If you are experienced in the field, you could become a guest speaker. If you are interested in patient advocacy and community engagement, an internship might be a better option for you. For clinical research industry stakeholders and pharma companies, they could sponsor our events. They can collaborate with us on patient educational programs, help us increase our reach, support the efforts that improve clinical trials representation. All of this is because our end goal is improved public health. Sponsors must bring communities into trial design early and collaborate with community organizations for continuous support and long-term sustainability. Together, we can achieve so much more. This is a journey, not a destination. We have a future that we must build together. When we support one another, we create a lasting change. Let's continue. Let's create trust. Research moves at the speed of trust. Let's create a future where everyone has equal access, opportunity, and representation in clinical research and healthcare. Everyone deserves the best when it comes to accessibility, affordability, or availability. I hope we bring a solution to the table so it becomes a real practice. And this work is essential. People need to know there are clinical studies out there and they give you hope. I would like to end with a quote: "Compassion is the child of righteousness." In order to be compassionate, we must do the right thing. Thank you.